All right, Mike, we are now live.
Welcome, everyone. It's 3:31. We're going to give it a couple of minutes just for a couple more folks to arrive. Welcome to the handful of folks that have just joined us in the last minute or so. We're going to wait about one more minute before we get going. Looks like the attendees is still ticking up just a little bit, so we'll give it another 30 seconds. Okay, well, seems like a good time. Welcome, everybody. I am Mike Zog, Program Director with Office of Community Partnerships within the Department of Disability and Aging Services. Welcome to Preparing for Reopening. Just as at the outset, wanted to cover accessibility and translation for today's meeting. Closed captioning, unfortunately, we've had some technical difficulties at the last moment, and it is actually not available live. I do apologize for that. That is something that we are looking to remedy. If we are happy to, there is going to be an email address at the end of this presentation. We are happy to respond to any questions or concerns related to that or need for clarification through either the email or the chat function today. This meeting is being recorded and will be posted shortly after. We do expect closed captioning to catch up with the webinar within the next business day or two. So that will be an option in the future. We do have live language translators in Cantonese and Spanish. If you would like to switch over to those channels, we have some sort of guidance here. You can use the, within the functions within Zoom, you'll see I've got a little sort of clip art here of the interpretation button. You'll want to hit that and that will allow you to switch over. Okay. So just the kind of the agenda for today, what we're going to cover. I think at the outset, I want to say welcome. Hello to everyone. Thank you for joining us today. It has been quite a 12 or 13 months at this point since the shelter in place with the city was established. I think that today's webinar is exciting because we are starting for the first time to see guidance about us really reopening and moving back towards the service levels that we had in the past pre-pandemic. I'm going to be joined by a couple of different speakers here today. One of whom is Cindy Kaufman, who will who will speak in a moment and provide her own introduction. But also want to recognize Julie Wong from the Department of Public Health, who will join us at the end for the Q&A section. We've got a lot of folks on today's webinar. I know that the invitation for this went quite wide, which is great, but I did want to just reiterate the intended audience for today's webinar. The material and the questions are really going to be focused on this audience, and that is program and operational leadership at community center sites who are involved in developing reopening practices and policies at those sites. For those who don't fit into that group, who have other concerns or questions, we will do our best to, I would encourage you to perhaps send an email. You can email questions to the email at the end of today's meeting. And we'll do our best to get you connected to the guidance that you are seeking. But I do want to say that we are going to focus the topics and materials covered today and the questions we cover to this intended audience. We'll do a little bit of housekeeping. We'll have some opening remarks from Cindy. And then I will be going through the reopening checklist, which has been shared out. I'll share it out again, and we're going to have a link posted in a second so that people can access that. We'll have a Q&A at the end. Today's event is being recorded, if you have not already noticed. That is so that this can be posted and viewed later. Audio and video, we respect all participants and their viewpoints in the community today and want to create a safe space for all. As a default, all participants are currently muted and video is disabled. Video and audio is only on for speakers at this point. At the Q&A at the end, we will be able to turn on some of the audio functions so that we can call on folks to ask questions. There is a chat function where we encourage folks to send questions that we'll cover during the Q&A. Using the chat function in Zoom, you'll be able to see sending a direct message to Q&A, Mike Zog. And when we get to the Q&A section, I will go through those questions and do our best to get through as many as we can. Recommended. Have a copy of the checklist on hand during this webinar for your review. And I've got a link here, which is not really of much great help unless you're going to try to type it really quickly. And I have forgotten to put it into the chat. So I'm hoping that one of my colleagues might be able to drop that link into the chat. Oh, I see a finger up from Cindy. I believe she's volunteered to do this. When we look at the checklist, for those who have already seen it, it is quite a busy document. So I think we're going to look at it quickly in its sort of full form, but it is quite detailed. We're going to spend some time on today's webinar kind of digging into the different columns and sections on it. So I will not have it, the full document up on the screen the full time. I think my recommendation would be if you have a copy handy or are able to check the chat, you can have an open copy in a different window, and you can kind of go back and forth between the two of them. Okay. With that, I want to bring forth Cindy Kaufman to say hello and give us take us through the next step of this. And you're on mute.
It has to happen at least once a meeting. Thank you. And thanks, Mike, for the introduction. I'm sure, even though I can't see you, I know many of you, but I am Cindy Kaufman. I am the Deputy Director with the Department of Disability and Aging Services. And I am very excited for this webinar today. I have been working with many others in the Senior Hub and throughout the pandemic always with a focus on older adults and adults with disabilities. But I think around last September or October, we truly started to take a look at this group. In the folks that come together in congregate settings that are not residential settings, and the importance of having guidance to both bring people in safely, but also because we also recognize how important these programs are for social engagement. So I'm very excited that this day is finally here. So the latest health order, which was updated on April 15th, and we can include this information in the chat as well, did include guidance around allowing adult day programs and senior and community centers to open. And if you take, and I really recommend taking a look at the health order, it is very long, but the more you can familiarize yourself with it, I think it starts to answer many questions. But the last page of the Appendix C2 in there includes small indoor gatherings, and within that section six, it clarifies that adult day programs and senior community centers qualify as small indoor gatherings, and that was a first to get them recognized within that. And then also that section provides links directly to the checklist that Mike is going to go over. And so the description for small indoor gatherings is that people from different households can gather in non-private settings, but they must, in all of these areas, they must comply with the following rules. If the gathering occurs at any business, which is also defined in the health order, they absolutely must post a social distancing protocol checklist and comply with all social distancing protocol requirements. Those are listed in Appendix A of the order. And just to clarify, the term business includes any organization, any house of worship, nonprofit entity, as well as commercial entities. So it is really a broad definition. In addition, the gathering is limited to the lesser of 25 people or 25% capacity. Every person must wear a face covering at all times during the gathering, unless they are exempt from wearing a face covering by this face covering order. And if any of you have questions around these, we are happy to give you the links and the order numbers and all of that to get more information. Now, for this reason, because face coverings must be worn at all times and social distancing, no food or beverages can be consumed during the gathering. Again, physical distance, we're still enforcing physical distancing of 6 feet or more from other people, especially if they are not in the same household. And then indoor areas need to maximize the ventilation wherever possible, including opening windows, opening doors, and allowing more airflow in the area for the gathering. So I can, as I mentioned, I can send the link for the ordinance. There is also a link for what is called the business and activities table, which just provides you with a nice table of various businesses and the guidance for their capacity, etc. The small indoor gatherings, which includes the adult day programs and senior community centers, was just recently added to this table. So I am happy to provide that in the chat. In addition, the checklist that has been published for these programs, we just included that in the chat, but Mike will now walk you through that. And I'll turn it back over to Mike.
Thanks, Cindy. Okay. Okay, so before we jump into the checklist, I want to parse out a couple of aspects of it. And first is that licensed facilities, first and foremost, should follow guidance from your licensing authorities. So adult day health centers, CBAS programs, that's going to be the California Department of Public Health or the California Department of Aging. for adult day programs that may well be the California Department of Social Services Community Care licensing. Those licensing agencies have jurisdiction over your operation and setting of guidances which must be met as a minimum for operation. The guidances provided by the city are not meant as a substitute for those guidances. And again, as Cindy alluded to, not included currently in the reopening checklist, congregate meal or nutrition programs. Those do need to remain in to-go or delivery operations until further guidance is provided on that, which we think is in the early stages of development. Okay, here we are, page 1 of this checklist. I don't know if people have seen it before. Perhaps this is your first chance. I will tell you, when I first looked at this, it seemed like a lot of information. And I found myself a little bit overwhelmed at first. But with time, I kind of understood it. And I think in a moment, we'll dig in and break down each of the different columns. It has a page 2, a second page of it, which is actually a really helpful resource, as it kind of just provides the various guidances and the levels of who's providing that guidance in a different format, in sort of a more reference format. All of the blue language are hyperlinks out or web links out to the relevant guidance. So we're going to jump into it in a second, but let's take a look and see that we have, I like to take this by column. We have 5 columns running from left to right, columns 1 to 3, covering prevention. These are going to be setting up how to set up your facility, how to work with your staff and participants, and how to operate programs in those guidelines. The 4th and 5th columns are going to be action steps that you need to be ready to take should there be any symptomatic clients or staff at your site, and the practices and procedures you're going to want to have in place should anything arise. So as I noted, columns, prevention. These are going to be your standardization, your standard policies and procedures that are in operation while you're open and providing services. Columns 4 to 5 are going to be your action steps to take should an issue arise. Okay. Again, I mentioned the second page is a table with resources and guidance. I think it can be a great way to cross-reference if you're looking for a specific topic or a specific publisher or licensing agency who provided that. There are some PIN notifications linked to on that second page provided at the state level. Those can be quite helpful. They're organized in a different way. For some, that might be more easily understood. So you can go ahead and take a look at that and see if that has a flow that works a little bit better for you. In the far right column on that second page of that checklist, there's links to sample signage. That is the online version. Those are ready to go for printing or downloading or placing on websites and other things. Hard copies of that signage may be available. Just ask, let us know, and we can see if we can get some copies sent over to you. As part of this effort, the Senior Sites group at the CCC has put together packages of signage and other swag that we are sending out to about 50 plus sites in the city. Some of you may have already received that. It is going to be coming via mail or delivery by DOS or Department of Public Health staff. So go ahead and keep an eye out for that, probably this week or next. And you can always proactively check in with us if you need signage or additional signage. And we're happy to help you out with that. Okay, So digging into that reference sheet, and hopefully you have one in a second screen or in a window. I'm not able to have that right now, and it's would actually be helpful. But column 1, going down, this is the stuff about setting up your facility in a way so that it's as safe as possible. So this means going through the social distancing protocol checklist. If you click that web link out through that, it has a very detailed description of how to set up your site in order to encourage and enforce social distancing for staff and participants. You will want to ensure that steps are taken to monitor sort of people flow in and out of entrance paths, avoiding bathroom crowding, and avoiding crowding in break room or gathering areas. We are encouraging staggering arrivals and departures. This is going to be both for staff and program participants as much as possible. You know, it's very common that services occur, you know, kind of between, let's say, 9:30 and 2:30 each day. To the extent that we are encouraging people, to the extent that it's possible, to try to spread activities across that time frame and even widen it out a little bit in order to reduce total traffic flow on site. There are also some transportation demands that I think are going to be tied to that, and I'll get into those a little bit more in a couple slides. Regular cleaning and disinfection practices, having those in place, as well as following guidance around air and ventilation practices for on-site operations. Column 2, this is staff and program participant guidelines. This is stuff that I think that a lot of people kind of already familiar with, but I think I want to highlight this again with the caveat of let's keep it up. We gotta let's keep maintaining this. We're working our way through this pandemic, and we need to not let down our guard. So that means health screening for clients and participants upon entry, continued use of masks, hand washing, social distancing. Again, staggering staff schedules to reduce staff on site at a given time. There's the idea of cohorting staff and participants as much as possible to lower risk. I think this can be a sort of a varying challenge from site to site, depending on the type of service. I think this is the idea that having the same group of participants and staff in the location at the same time each day, and having less intermingling of staff and other groups of clients as much as possible. Designating a point person for communications with the Department of Public Health. That is going to be very important when it comes to the action steps. Knowing who your person is in your organization that you're going to say, hey, it's time for you to get in touch with Department of Public Health, or because we have a situation and we need to get guidance or update them on something that's happening. Column 3 within prevention. This is your program operations. This is in many ways just saying, you know, we've put these guidelines in place in columns 1 and 2 to have our facility set up in a certain way and to have our staff and participants responding in a certain way. This is then infusing those into the activities that are going on. This is ensuring that during those activities that people are wearing masks, that they have been hand washing, that social distancing is maintained. That might well mean modifying activities to meet guidelines, because less people can fit in a certain space that an activity might be happening. We encourage reducing group size as well as shortening the activity time. And I think it's been mentioned for a while now. It continues that outdoor activities are always best. I did want to take a second to talk about transportation services. Many clients are coming in and staff are coming in different forms of transportation. You'll want to check there are separate guidelines for transportation that have been developed by Public Health and MTA, as well as paratransit. There are some hyperlinks in the checklist that you can link out to understand some of the requirements that are going to be in place for transportation. Thinking about participants who are coming in on paratransit or other group van services, I want to kind of mention this in the context of the spreading out of services throughout the day. I know that transportation services are going to be very impacted in the middle of the day. This is there is going to be some time as they ramp and staff back up operations to move back towards pre-pandemic levels of service. But those vans are not going to be able to carry as many people. So there is going to be a slow ramp up and a bottleneck. So I think that the more you can think about working with the transportation provider around scheduling services sort of outside of that midday bottleneck, I think that's going to reduce that as a barrier for clients to reach your site. I would also note that if you are a site that is working to reopen and utilizes a lot of group van services, I would reach out to your group van contact sooner rather than later to at least give them an idea of what you are planning and what you are kind of seeing as the sort of evolving size of your program space and your need for group van services so that they too can plan accordingly to be ready. Okay. Jumping over to the fourth and fifth column, the action items. Sites must be prepared for immediate action should a staff member or participant screen for COVID symptoms or report a positive test. And this means includes things like the ability to screen, isolate, and ensure safe transport of individuals who are identified on site. You'll want to identify an area of your facility or room at the site to separate anyone who is exhibiting symptoms and having them safely distanced while other aspects of your plan are put into place, figuring out what the next steps are. How is this person going to get home or to other resources as needed? You also want to have a plan in place to disinfect immediately any impacted areas and isolate or quarantine any potentially exposed staff or participants. I want to just sort of highlight that these things, well, all of this really should be in place in advance, so that the idea that you're going to need to do these things if it happens, not having to figure out where that room is when it's time. Please do pre-identify your area for isolation. Start thinking about the various forms of transportation that clients come in on and whether that's going to be a viable option back in the other direction. Are there family members that need to be contacted or other options for getting that client safely to their next destination? Okay, and then communicate. As soon as sort of these action steps pop into place and you are working with your action plan for a symptomatic client or staff person, you need to provide notice to us. And the first notice goes to a licensing agency, if applicable. So if you are one of those earlier mentioned licensed agencies, you are going to notify them. And you are going to notify the community branch of the SF COVID Command Center. There's a phone number listed here. There's also an email address that will be posted at the end of this presentation. Phone number is the preferred way to go. If I wasn't clear, if you are a non-licensed, if you are an agency that does not require a license for operation, you don't have to notify the licensing agency, but either way, you need to notice the community branch of the COVID Command Center. The community branch, who are you calling? Who are you talking with? It is going to be likely DOS or Department of Public Health staff who will collect information from you about the situation, and they will be empowered to seek to provide further guidance to you or seek guidance or connect you through to the outbreak management group and other aspects of Department of Public Health and the COVID Command Center. And again, I noted both that phone number and the email address are in the checklist. Okay. So what does it all mean as you put this together? Reopening is not going to require a pre-review or pre-approval by the city of San Francisco, except for sites that are subject to licensure requirements. For those, you will need to get your plans approved by your licensing authority for your adult day programs or adult day health centers. But for sort of traditional community centers, there is not a required pre-review or pre-approval process. However, you do need to have a plan in place and ensure that all those guidelines are met at the time you plan to reopen. You are ongoing support and guidance in helping you set up and implement that plan is available. Again, the email and phone contact information for the community branch and the email address are mentioned on this PowerPoint as well as on that checklist. We are happy to provide support as you work through the various steps needed to have in place. Now, will anyone come and check your plan? And the answer is most likely yes. DOS and other site visitors will be coming out in the near future to check how things have been going and make sure everything has been set up accordingly. So it is something that will be checked at some point in the near future. There is not a sort of timeline of when those checks are going to happen, and they are not necessarily formal inspections per se. They will be perhaps informal visits where we are able to just check in to make sure everything was set up correctly, and if there's any sort of pending questions or assistance that can be provided, we will do that. Of course, if should any symptomatic cases or other issues arise at your site, then your plan will be reviewed to make sure that the best practices were in place to try to avoid any issues. The audience for this webinar is wider than just DOS funded organizations. For all, the community branch phone number and email is available as a contact point. But I would also additionally add that DOS contracted providers who are involved in this, you are free to contact your assigned program analyst directly, and they can help you through this process. Okay. Just a quick break, just to encourage continued vaccination. To step up when it's your time. I think we are now at anyone age 16 and over. So I would assume that's everyone on this webinar. I know that there are still issues with supply and some access, but we are continuing to encourage folks to get vaccinated. Okay, and we've reached our Q&A section. So you will be able to send questions through the chat function, and it looks like there are a bunch of them in there right now. And you can also use your raise hand function, and we'll be able to call on you and ask you to unmute at that time. But what I want to do first is I had a couple of questions come in early that I want to take a look at here real quick. Let's see. Sorry, while I look this up. Sorry, I've got a lot of different screens going here. Oh, okay, here we go. So some of the questions that that have already come in. Do I need to reopen for services? And if so, do I need to do so immediately? And the answer is yes, you do need to reopen for services. As to immediately, I think that it's going to be a different, there's going to be different challenges from agency to agency and site to site. But generally, all should be working in the direction of opening sites. Um, uh, you know, there are many reasons why, but I think most importantly, our network of services for older adults and adults with disabilities in the city are critical links for a variety of services for people, everything from connection and engagement with others to connection and engagement to resources and other information. I think that as we navigate our way out of the pandemic, our centers are going to be more important than ever as resource points for services. Each of you out in the community are going to be very important to DOS in helping us understand the needs of the clients as they come and see you and how we need to respond to them. I think we've also seen a lot of development of sort of COVID relief emergency programs, which are not necessarily permanent. And I think that we are going to, there will be some exploration of what programs stood up for COVID need to continue and what are available through other resources in the community. Okay, does the center need to comply with an inspection from the San Francisco Department of Public Health in order to start reopening? And the answer to that is no. So if you are licensed by the state of California, you need to follow your licensure requirements, and that may include pre-inspection or a pre-review of your plan. But for community centers that are not licensed by the state, you do not need an inspection at the local level. You are, by reopening, you are assuring us that you have developed your own, you've gone through the checklist and you have developed your own plan and internal policies and procedures to meet everything in that list. A big one that we got a lot of questions about, are we allowed to ask for vaccination cards for our participants? Are we allowed to track vaccinations? Will agencies be given discretion to enforce a vaccination mandate for in-person participation at services? And I can tell you that there is no city guidance on this. And further, the Department of Disability and Aging Services is not requiring this of its own staff, that they be vaccinated or demonstrate vaccination status. And we are not going to mandate this for our contract. We are, however, going to defer to each agency to develop their own policy and procedure based on what is best for their organization. And I think that we have such a unique group of, or a diverse group of providers and services being provided that I think that determination is going to be a little bit different from provider to provider. And it's something that will be handled at the agency level as you go through your own risk assessment and HR processes at your level. Okay.
Mike, can I jump in on that just a little bit?
Of course.
That is absolutely true. We also don't know what's down the road. So we will follow all, as with everything with COVID, we will follow all CDC, state and city guidance. So if changes happen, we will let you all know, but that is where things are at right now.
Okay. We had one said, will a combination of modified takeaway and in-person meal service be permitted? And I left this one in here because it's kind of a trick question. There is no meal service, in-person meal service allowed under the current guidance. This question may well become a very good question as we get more guidance around in-person meals, and we will looked, we can provide more information on that as that becomes. Will agencies be given the discretion to enforce the mask and social distancing policy? Will agencies be given the discretion to enforce temperature checks for in-person participation at program sites? And there is not discretion at this time. Mask and social distancing policies are required, as are health screenings for folks entering the sites, staff and participants. If you look closely at the guidance, it doesn't speak specifically. It asks you to ask about temperature checks. I don't think that it specifically requires you to take the temperature. We see it as a best practice that agencies take temperatures at the time of screening of staff and participants. Okay. So that was my preloaded questions. Let's take a look at what we've got here. The chat is very busy. Okay. Okay, does capacity refer to license capacity or staff and license capacity? It's a good question. Cindy, do you know that?
Sorry, looking for my mute. And I'm looking at Julie's face right now too, to make sure this is right. But my understanding is it's participant capacity. It is that staff is you staff it and then it's 25% or 24 participant capacity. However, you need the number of staffing in the, to meet the needs of the participants.
Okay. Are there exemptions to the no eating and drinking order, such as when taking medications or needing water to stay hydrated? There are not, I am not seeing in writing exemptions to these, to the no eating and drinking, but I think that obviously people need water, people need medications. There may be situations where someone needs to eat a snack tied to a medical or dietary need. I think that agencies and sites should be planning for this. I think that taking sips of water and quickly and recovering with a mask is probably acceptable. For meals or medications, snacks, I think you will want to develop best practices around briefly distancing that person so that they can take care of those needs before having them return to the group. Okay. The health orders, I've seen a couple of these. Health orders, For inside events, allow for areas for unvaccinated where social distancing can be modified. I think I saw some flip questions that kind of talk about increasing capacity for vaccinated folks. There is guidance, that guidance is not applicable to these sites at this time. We are not distinguishing between vaccinated and unvaccinated within the universe of the community centers. Okay. A couple follow-up clarifications on kind of water drinking. I think that, again, we're not going to refuse water to people. I think just having common sense policies around water would be great. Having a water fountain in the middle of the room would be not a great idea, or having a water cooler or something like that. I think if people bring individual waters, or you have individual disposable water bottles for folks that they take with them or are immediately discarded, I think that is acceptable. Okay. Reporting an incident to the community branch. What does an incident mean? And is that someone who was screened sort of away from the site, that they presented at the door and screened to one of the the fever or the other symptoms, or that it happened within the site? And I think that it's best to err on the side of caution and report any experiences like this to the community branch, so we can assess the sort of facts around that situation and then sort of act proportionately to what might have happened. I think anytime this is happening, you'll want to, of course, be thinking about who that person might have interacted with, and perhaps not just on that day, but in previous days. Okay. Okay. There's a question of, do we have a plan template? We have a plan prepared, but would like to know if we missed anything. I think that checklist is the plan template. I mean, I think it's going through there and knowing that you have each of those in place. You'd like to know if you missed anything. Hopefully that will cover it for you. There's a question of, is it worth sending a copy to your DOS analyst for review? Of course, that's great. You can share it with us. We can take a look at it, be another set of eyes, and we can have it on file. Let's see. We saw one about, will the COVID Center replace the requirement to notify the employer's email at DPH? Are they connected now? Julie, is that one that sounds familiar to you? Okay.
Yeah, unfortunately, I don't have the answer to that one.
Okay, well, that person can message us or can email us or call us, and we can, I know that they have my phone number or email, so, or they can send it to the site's email. Okay. We've seen some concern from providers around staff realizing that a substantial portion of staff are not going to be vaccinated, and that's giving pause to the organization around how they want to plan to reopen. I think that is one that we should have a follow-up discussion on to think through how that might work. I think that is a legitimate concern and would be factored into reopening plans. There is a question about sort of moving from sort of a drop-in model of services to a reservations model of services. That is, we would defer to the agency for how you would like to handle that. It does mean that, I mean, regardless of how you choose, you are going to need to have some sort of policies and procedures in place to be monitoring for where you're at in capacity in the site and whether you're getting close to that and what happens when you've reached maximum capacity.
Mike, in addition to that, best practices are to cohort as much as possible, which makes it difficult for drop-ins to a certain extent. So just keeping that in mind, especially as you start to open up, and as it can possibly change as we move to different tiers.
Okay. We've had a question, there's a question of, okay, so the city is not providing guidance on vaccinations, they're deferring to us. Can the agency, first off, can they require vaccination of staff? That is an agency decision. Can the agency do encouragement and public education around vaccination with the idea of encouraging vaccination for both staff and participants? And the answer is to that is absolutely yes. There is nothing wrong with that. Encouraging vaccination is sort of the city policy and most all department policies, as far as I know, certainly DOS and the Human Service Agency. Let's see. Okay, I think there's one, and I think I understand this question. Is it permitted for agencies to inform participants at a site that some are, we are not requiring vaccinations essentially, or we're not checking for that, and that there remains, a risk for participation in activities? And I think that is fine. I think you can't, I would be cautious about collecting or revealing health status information, but having people in your site understand that it's not necessarily a vaccinated site and the risks that come with that. There are actually risks that come with interacting with vaccinated people. I think that is acceptable for the purposes of helping clients make informed decisions and understanding their risks of attending services at the site. Okay. There are a handful of, does DOS have an anticipated date for the reopening of nutrition sites? Not at this time. Not at this time. That is I think that's, I don't know, Cindy, if you want to say more. I think that's the next big hurdle, perhaps.
Right, and I realized on my slide that there were two more little bullets, and that was part of it. That is something we are currently having conversations around. It's a moving target, and I think as you've seen San Francisco go through different tiers with different businesses reopening and expanding, opening, for our world, adding food and nutrition is part of those conversations, and so we are having those conversations in order to see what that looks like and what the next steps are and when. So While we don't have an exact timeline right now, the conversations have already started and even started prior to where we are at. And so they will continue, and we will absolutely let you know as soon as we know anything.
I'm continuing to see questions sort of tied to vaccination. And I think one thing that perhaps wasn't asked directly, but information I would volunteer, is that absolutely, if your agency is having challenges with vaccine access, in so much as that you're noticing that a lot of your staff are just not able to get vaccinated, or your participants are reporting, hey, we'd love to be vaccinated, but there is some barrier to that. That is something that absolutely should be communicated over to us. I think that is something those are barriers that we are trying to identify and remove. So if understanding that it's not perfect yet, but if you're seeing like a wide scale barrier, let us know, or even a small one, and we will happily work with you to try to work past that and get vaccinations for those staff and clients.
So in addition to that too, there is, and I will go look for the number, I should have it memorized, for some folks who are having problems getting actual appointments, there is a call center that's been set up and they can assist with getting appointments. So Mike is absolutely right. Let us know, because we are working with COVID Command around making sure that older adults, people with disabilities do have access to vaccinations. But let me find that phone number and put in there, because they are also a resource for you.
I think there are a number of questions around contract deliverables with DOS contracts and what our expectations are around those. I think that's very to be determined. I think our expectation is that we would like to see good faith efforts from providers to continue providing services and reopening. I think over the past year, we've been quite flexible around contract deliverables. And I think that will continue to some degree as we move back towards pre-pandemic sort of society. Okay, there are a handful of very specific, I think DOS or program related questions. I want to defer those over to just an offline conversation to kind of work through the facts and the situations there, as I think it can be a little bit different from situation to situation. Okay. Do we have any, oh, here's a great one, about the whole trying to have a separate entry and exit, and how that is a very much a site by site resource, I guess. And many people have one door that's for entry and exit. And unfortunately, what it means is that you are going to need to develop some sort of flow or practice that minimizes, close interaction in that entry and exit way. So whether that means someone monitoring the door, perhaps at the more extreme, to trying to implement signage for a sort of one person in, one person out flow. I think that will be a challenge to the providers to try to work through. That's actually going to be a good one. The DOS and DPH staff will be kind of seeing how this all goes and hearing feedback. And I think to the best we can, we'll try to share out best practices we're seeing. Certainly, if there's an aspect of this that's particularly challenging, letting us know sooner rather than later is probably a good idea, so we can start thinking through solutions, but also go and talk with some of our providers to get some ideas on how they have dealt with this. Okay, so we are just about at time, or we're at time. I didn't do the hand raising thing. Are there hands raised out there? I didn't see. It was going pretty well with the chat. Maybe we should just stick with the chat.
Yeah, Mike, just to let you know, yeah, I didn't see any raised hands. I think you're right. There was a lot of questions in the chat.
Okay. Chat has worked pretty well, so stick to chat. Okay, so what am I going to do here? I actually have a very nice thank you slide. Let me see if I can actually get that thing back up. Well, it's not very nice. Well, and it started me all the way back at the beginning. Okay, it was a nice try. It basically said, thank you everyone for attending. We really appreciate, I mean, we're all still in tremendous appreciation for everything that has happened over the last year, all the work that all the folks on this message have been, oh, there we go, thank you, all right. Just tremendous appreciation of everything that's happened over the last year. I mean, the amount of services that were delivered, things that the way that people just pivoted, modified, set up new programs continues to be just really impressive. This is the latest hurdle, but I think it's a good one. It's a whole new checklist of things we have to put in place, but it's one that is leading on a path towards a reopening of the city, and a re-engagement with older adults and adults with disabilities who we are here to work with and be a resource for, and perhaps re-engage them and remind them for those that we have lost contact or lost a lot of engagement with. There's that email, it's on the checklist, day programs at SFDPH. That is a monitored email that you can send questions to. Any other comments from the folks on here?
No, just to reiterate what you said, I'm really happy so many people attended, and we are really more than happy to answer questions and help guide through this process, because questions will come up. I know somebody did mention something about plans. There are, if you do some searches, there are plans out there that you can take a look at to give you some framework. There's a link also on the checklist for the Department of Social Services for Adult Day programs that also gives you an outline and some guidance that helps you, if you haven't thought about it, helps you kind of start to frame things and put things together. But thank you, and as questions come in, we will gladly do the best we can or reach out to those who know the answers.
Okay, thank you.